we just went to the SVC, which is the Superior Vena Cava.
Yes.
And going into the IVC, Inferior Vena Cava, no?
Yes.
Yeah.
Which
Going
should
that
go
way?
all the way down. Yep.
Oh yeah, there you go.
Awesome.
Yeah, and then right there. Right? It's
Nice.
connected. So we just cut the. This is the.
Yeah. So where you cut there, yeah, that's your
right. I call it
atrial appendage.
Atrial appendage, and this is the left atrial appendage.
Yes.
That's right. And then we just cut it. And then you can see those grooves right there, and that's why it is very prone to clots, you said, right?
Yep.
Because of those
grooves.
And now we have to cut the.
Yeah. Yeah, so you should be able to cut it straight down that way.
And you can see that it's connected to the pathway.
Let me see. Oops. This is the atrium that I'm cutting, right?
You might be all the way through the ventricle now. Yep.
Really?
Yes,
Oh.
you could actually probably. Well, that's probably enough. But you see right here, you've got like your valve.
Is this
So
the valve?
yeah,
Oh, I passed.
that's your
through.
tricuspid valve.
I'm
Well,
done.
you were supposed to, so that way you can see both the atrium and the
Okay,
ventricle.
so but this is basically supposedly just for the atrium here.
Yes,
But I cut all the way to
the ventricle.
Oh, this
yeah,
is, this is the valve right there.
exactly.
Right
Oh, she's
there.
going through some anatomy here. It's like above the CS, but a little above it. Yeah.
Okay, let me continue.
I felt something that just feels like different. It just felt different than everything else.
So what are we doing now? Cutting through the ventricles? No?
But also another thing is the ventricle, like see how much thicker the tissue is here. So whenever we do ventricular ablations, we have to bring a lot more. Get a lot more. So we cut this open. So as you can see, you've got your tricuspid valve. These big things here are your papillary muscles. So that's what helps like contract.
This one here?
Yes. Yeah. So that's what contracts the valve.
That is just right after your tricuspid valve, huh?
Yes. Yeah. So see, they're kind of holding on to these chordae. These are actually like super strong too. So you could actually hold the whole thing up by these.
Wow. Really?
Yeah.
Let me see. Very strong.
Yeah. And that's because they open and close the ventricle. So they have to be super strong. Okay, we're also looking for our CS. So our CS is going to be in your right atrium. The os will be, there should be like a hole that it's going to wrap around. So I don't know if you can find it. Coronary sinus.
Coronary sinus.
Yes.
Okay.
So I think it's right here. And you can see it runs through. Yeah, you can keep feeding it through.
And it goes to where? Around?
So yeah, it should probably go. It should go actually down here. Yeah, that way. So it'll go under the appendage. You may not be able to. It'll start getting more narrow, but it wraps around your left atrium.
I feel it.
It
So it
separates.
goes from the right to the left?
Yes. So every ablation case we have, we put a catheter there because we can get information from both the right and the left side at the same time. And then we can also get both atrial and ventricular because it separates them. So we get lots of information just from that.
Oh, wow. Yeah, so this is your sinus, your coronary sinus. Huh?
Yes.
So the blood goes through here too?
Yes. It goes from
This one has
basically from outside your body into the right atrium.
But this is just going around, it's like in between the atrium and the ventricles, and going that way
From right to left.
Right to left. Okay. So what's next?
Let's see. So yeah, you can see the papillary muscles, chordae, up there where it's. Oh, the AV node? Yeah, I've been trying to get them to feel that too. So sometimes you can feel the AV node. It'll be above where the CS is. So it'll probably be. It feels like a grain of rice sometimes.
Oh, so you will feel the SA node?
The AV node.
AV.
Mm-hmm. It might be.
Because AV is close to the ventricles,
Right.
Like just below the atrium.
Yeah, so it'll be like right around.
Is it like
It may be hard to. I've heard it feels like a little grain of rice or something.
A grain of rice?
Yeah. Sometimes you can't feel them though, but it depends on the heart.
So it's like a little muscle or something.
It's like a. I don't know what exactly it's made of, but it's like contained in a little.
It's a battery.
Structure. Yeah, basically.
It's a battery. Do you feel the SA node over there? Not the SA, the AV, right? AV node.
Yes, AV node.
If you guys feel the AV node, can I feel it? Yeah. Do you feel it? There. Do you feel it? I want to feel it. Sorry.
Try.
Oh yeah. Is this part the
Those are the corners.
This part, that ridge, that's the actual part.
Oh, where's mine? Where's my AV node? I mean,
I cut through the septal wall and I can go all the way up the
maybe mine already had an ablation. Maybe. That's why I don't notice it anymore.
Like capillary muscular tissue on the endocardium. That thicker tissue in the right atrium is called the moderator vein in the septal papillary muscle, and you have little corrugate that comes off of it that latches onto the tricuspid valve. So this is how your tricuspid valve opens and closes. So this is an area where we actually go in and ablate in the surgeries. People get PVCs that come from here. It's a little bit of a challenge, as you can imagine, because they're just looking at fluoro. They have ultrasound, intracardiac ultrasound, and then they have our mapping system, but they still have a bunch of corrugate that their catheter has to wrap around.
The corrugate are actually really strong, so even if you grab just like one of the little
Yeah.
You can hold up the whole thing.
Can you imagine that? Wow, very strong. Wow.
Yeah, you could
I couldn't feel the AV node.
You feel it?
No, I don't.
Because it's deep in the septum. Not that deep, but it's right on the septum there.
Right in the septum?
Right on the septum.
If you try one of them, then you can.
I felt the one over there. So it's just right there by the ventricle.
Right, exactly. Right by the tricuspid valve there. Yeah. Maybe you can feel a little bump or something.
I felt over there though.
It was clear? Yeah.
It was clear. I told them that maybe I already had AV node ablation.
Very good.
So when they do ablation, do they like a shrink it?
No, they cut off the circuit. But those are the ones who get pacemakers.
But will it? I'm just wondering. Will it still be there, or is
It'll still be there, but it won't be functioning.
it will be functioning? So what do we do next? Do I need to cut this one here? This is the ventricle here, huh? So the left, the right ventricle is small.
Yes, compared to the left.
The
Yes.
left, yes. Do I need to open it up more?
Oh, no, we're going to go to something else now.
Okay.
You may have more of our
So where do we go now?
Let me see what she wants us to cut. She wants to go up here. Let me see.
Go ahead. By the way, you're on a video. Hi.
Oh, no, you're good.
This is fun. I like it.
Good.
I know.
What's that now?
The pulmonary artery. Yeah. Keep going right.
Wait, yeah.
See that? It's going right up here. The pulmonary artery. You can
So
follow that
the
with your finger.
pulmonary artery, this is the one that is connecting from the right ventricle going to the lungs.
Correct.
Right?
Correct.
Okay.
And you can see that here. This is it here.
Connected to your lungs. Okay.
The structure here.
I just like doing
Yeah, go ahead. Put your finger right in there.
Oh wow, this is big.
Yeah.
Big.
Well, that's the
Okay,
right-
wait
that's
a
the
minute.
ventricle.
This is the ventricle here.
Yes.
Okay, the ventricle right there, right? Oh, this is part of
All
the
back,
ventricle.
yeah.
All this back,
Yeah.
and then you
Go
go.
right up there.
But it's still big.
Yeah.
It's like one.
You see that?
Okay. And then it just goes straight to.
The
Oh,
lungs
look at
right there.
that. So it goes to the lung. It's even like big as
That's like
wow. So the blood clots can form here.
The cuts and form anyways.
Yeah,
But less likely there.
less likely. But the pulmonary embolism, I'm just thinking that can throw from here to the lungs.
Yes. Yeah, that's where the
Wow,
problem
that's
is.
why it's big. Wow, that's big. Okay, that's good to know. Wow, that's cool. So it's still complicated. The way the heart, the form of the heart is complicated. It's not just like like this, and then you will have your atrium at the above, and then below is the ventricle. No, it doesn't go like that because the ventricle goes from here, goes that way, like not really like
Correct, not like how we- yeah.
like just like our heart, boom, 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 boom. Okay, what's next that they want us to do?
Not just yet.
Not
Slow
yet.
down. Yeah, you're too
You have
fast.
to slow down very too fast. Well, because you are helping me. That's why you're helping me. Thank you so much. Thank you. I love it. See, can you see that? So this is the tricuspid valve. Look at that. You can lift that. See that? That's very tiny right there. But that is a very strong one. Even just one like that. You can even lift the whole heart like that. Even just one, how do you call it? Corday? How do you call this one? Corday? The thing?
Yeah, the little strings.
Yeah.
It's called cordae.
Corday?
Tendonae.
Tendonae. It's a tendon, huh?
Yeah,
Yeah, it's basically
exactly.
a tendon. So you can even lift the whole heart
Yeah,
right there.
your cordae are really strong.
Yeah, very strong. Wow. It's very interesting.
You can get them at
All right, Sarah said this one here, this is the right ventricle going to your pulmonary artery, but this side of the ventricle, there throw a lot of DVCs.
Yes.
There's a lot of, we call it RVOT, the right ventricle outflow tracts. So it quivers like that. So if you drink a lot of coffee
Or energy drinks.
the monster, you have to limit those because it can excite your ventricle. Thank you. Wow.
Oh, that's cool.
Quiver. Now let's cut off the left atrial appendage. I've been waiting for this. I'm
Yes.
interested in this.
This is going to be cool.
Since I am a atrial fibrillation patient, I will be very interested to know about this appendage. So just cut anywhere?
Yeah, you can just pretty much cut it almost off if you wanted to, just to open it up at least.
Just to open it up.
Yeah.
Here we go. Wow, look at that. There's a lot of
There you go.
Do you have any clots?
let's see. I don't have class, I think.
Okay.
So I think this person is taking Eloquist.
Yeah, they must be. That pig
But
has
look
a-
at
that
this.
pig has a big clot.
Yeah, I saw that. Look at this. It's like a. It has like, how do you call this one?
Trabeculation. So same on the right side, but they're a lot thicker on this side, which is why they get clots pretty often.
Tuberculation, you said?
Yes.
So let me cut it. Then, yeah. So it can open. So this is the empty, like an empty space, huh? And this is where the clots can form.
Yes. Yeah, so that's where they put the Watchman too.
Oh, now I know why the Watchman is kind of big. Because I've been seeing it, I'm like, this is just too big to your heart, to your appendage. But then it is really big place. But how can it fit for everyone? The Watchman,
They come in different sizes.
Oh, it comes in different sizes. That's why they have to measure it before doing the procedure.
Yes. Yeah. They're also all different shapes too. I don't know if it's the same is true in these pig hearts, but in humans,
You are
they can
from
be different.
Carto, right?
Yeah.
That is the Watchman.
No, we're the mapping company.
You're the mapping company.
Yes.
Oh,
So we map
okay.
all the ablations.
Oh, okay.
Yeah.
All right. So I have observed we don't use so much amulet. What happened to amulet?
I don't know. They're similar. I think it's just
That's
a different
Abbott, right?
product.
Is it
Yeah.
Abbott?
I know that Watchmans are more like adapted by the whole like community. I think they were first to market and they have just like a lot more experience. So
We
amulets
have some
are
amulets
newer.
before, and then they stopped using them. So I was wondering.
I think it's doctor preference, so it's like whichever one they like better. But so it probably just depends which doctors are coming here.
Yeah. Okay. So now we are. This is huge.
Yes,
right there.
it is.
You can put a whole cow.
Pretty much, yeah.
It's huge. Yeah.
This is what we do every day.
And think about that the atrium, the left atrium is. We haven't cut the left atrium, but
It's in there though.
it's in there. Oh, you have a little clot right there. That
Ooh,
can
there you
still
go.
that can still cause stroke right there.
Yep.
It's kind of like playing a video
Wow.
game because it's like, we're during the procedure.
We have to use scuba din now, but
Yep.
And
Wow.
we're sitting behind a computer.
Oh, what is this going to?
So that,
It's kind of like the
Oh, it's just like a sack. Oh,
I think it might just be. It shouldn't go through to there, but I think it's just close to some other vessels, so that's why. That's probably.
yeah, I can push past my. Oh, somewhere.
on a daily basis.
Oh, what is that? Additional sack for the blood clots.
Yeah, that's probably just part of your. I don't know. It shouldn't go. Wait. Oh, that might be part of your aorta. No. It's your aorta. You should be able to. Well, we'll get to that part. We may have to cut it more.
Yeah,
to
we
get
have
to
to
the
cut
aorta.
more
Yeah.
to see what it is.
Wow.
This pulmonary vein, pulmonary artery is really big.
Yes,
It's
yeah.
really big.
Kind of like we did on the right side,
Can you open it for
coordinates down to the so along the side of the
So we have to cut now.
Yeah. So you do the same thing that you did on the other side, where you just kind of cut it down.
Done. Okay. So let's cut through the atrium to the ventricle. I don't want to cut my mitral valve. I want to see my mitral valve.
Yeah, you'll see it. You just have to cut through it to.
You want to see the mitral valve? You can see a top view on ours.
Oh, okay. Oh, that's awesome.
This
Here,
is
look.
really thick.
You can see the whole thing. Wow. That's awesome.
There is my valve. But how come mine is not that prominent? Let me see.
Oh, you've got a clot in your ventricle. There's one.
No, a clot
no.
right there. That's ready to kick out from the ventricle to the aorta and then to the cerebral.
Yep.
Okay. This is really thick, huh?
Exactly.
That muscle
Yeah.
is thick.
So when we have to ablate in this area, we have to ablate at really high power.
I
And
don't want
with
to
really
cut
high
my
force.
mitral.
Yeah, you don't
Where's
have
my
to.
mitral?
So you see like your flaps here.
What's that flap?
That's all part of your valve. So all this goes together. And when it's closed, well, you may not be able to see it, but yeah, there you
Oh,
go.
it's like that. So
Yeah.
basically, oh, okay. So it goes that way.
Yep.
because I cut it in between through there.
Yeah, just so you could see both chambers. But
So this one is
yeah, so those are super strong too.
that's
So we get a lot of PVCs. You see these papillary muscles, these thick muscles that are attached to all this chordae. We get a lot of PVCs there too, up there around this area, which is really hard to ablate.
Below?
Yeah, like underneath and above, kind of all around. And that's a pretty tough area to ablate because they get kind of like caught in these. It's also really thick, so sometimes the PVCs will just escape from different spots.
So when you ablate, so your catheter goes through from atrium to passing through the mitral?
Yeah, so normally when we ablate in the LV, we'll get arterial access and go through the aorta, come down into the LV.
Okay, so you go this way.
From the aorta, yeah.
Go that way and go this way, huh?
Yep.
And then do ablation here, somewhere
Yep.
there. This is very thick muscle.
It's really hard to ablate there and get success because you have to get
The
really
PVC,
thick.
the PVCs, huh?
Yeah.
But you said that most of the PVCs came from the right ventricle.
But sometimes they do come from here.
From the left.
This is the second most common area.
Okay.
Yeah.
So when they do the ablation on the right, that's when they do the AV node ablation?
AV node ablation will be in your right atrium.
Yeah.
Yeah.
So that's when they do the AV node ablation. Because there's a lot of PVCs on the right atrium. I mean, right ventricle. I'm sorry.
That will usually, so AV node ablation is usually the last resort.
Okay.
And it's just so that it, because like your atrium with AFib is beating so fast, sometimes if it conducts super fast through the ventricles, that's going to make you uncomfortable because your heart rate's going to be really high. And so normally, like, they'll do a PVI first, they'll do, you know, multiple AFib ablations, unless you're like older, or an older patient where they can't really be under for that long to do a full PVI, then they'll just burn the AV node, but you have to have a pacemaker, because then that basically puts you dependent on your pacemaker for the ventricular contractions. So that way it's not conducting all those like fast beats in the atrium. So the left atrium is right up here. That's where AFib kind of lives. Like that's where it originates from, is the left atrium.
This one is interesting now because you said this is the atrium. Where is my 4 PV
Veins. So the pigs usually only have 2.
Oh, the pigs only have 2. So
yes.
he's a pig, by the way.
Yeah. They don't have 4, but let's see. This should be, that might be actually what you were, what you put your fingers through earlier. So I think it's these, maybe. Let's see. Hold on. It should be close to the appendage. So, oh, yeah. So I think that's what.
Okay.
Hold on. Yeah, I'm getting. So it's probably where those holes are. Yeah. Because this is the left atrium, so.
Oh,
Yeah, it's
I
like
think I
those
saw
holes.
something.
Yeah.
Let me see. Is that? No, that's
There's one here, I think. You see where that hole is?
At least I will see one. This one?
Yeah. Yeah.
Oh, there's 2.
Yeah,
right
there you go.
They're so small.
Yeah, I think they cut them off a little bit. Normally they're bigger than that, but. Yeah, so whenever we do a PVI, we'll burn around those, like just a circle around them.
Around
Yes.
each or around?
Around, usually both at the same time. So you, in humans, you have 2 on the left side and 2 on the right side of the left atrium. So they're kind of like,
So if this is human, this is there's 2. So
there would
you
be
go
2
this
on
way
another
here?
side. Yeah.
Not each like that.
Well, I guess in a human you'd have 4, so you'd go around 2, around 2. But with in the pig, you would just go around the 1.
So you have 4 PVI. I mean PVs, and then you just burn
2 and 2. Yeah.
2 and 2, not
In humans.
not each.
No,
2
because
and 2.
sometimes if you burn around them, it can cause them to stenose. If you go around each individually, so they make a bigger circle. Yeah.
So
But that's where AFib originates, like pretty much 90% of the time. It's originating from the pulmonary vein, so that's why we isolate them. We just burn around them, and that like isolates the conduction from reaching the rest of the heart.
So this is the pulmonary vein right there. There's two, 1 and 2 for the pigs. But this is so small, huh?
Yeah, they're normally like a little bigger.
Yeah, I'm expecting bigger.
But that looks right though.
And then they can just ablate here.
Yeah.
Let's see. Maybe I can see some, because this one is
Normally you can see
is a
where it
different,
exits.
you
Yeah.
know, anatomically not the same as others, because the AV node, I didn't even feel it, so it could be different.
Yeah, we can ask Adam. But yeah, this is one of them at least. It might just be one.
So let me see, which one is it you're feeling? This one?
Yeah. Hey Adam, question. The veins.
We're trying to find the
Yeah.
AV.
I just don't really see like where they. I guess it's just this one.
Yeah, sometimes they cut it like really close to it.
We found these little like
Is that the
holes.
one? Because it's too small, I think.
So
They do look pretty small.
yeah, I was with Sarah over there, and we also found that on hers, and we're
Okay.
like, and that's the only thing we could really find. So
They may have just cut them really
yeah, but it
close.
still seems really small.
Yeah.
That's for sure.
But yeah, I was explaining. She has AFib. So
Genetically modified pig. Just kidding.
yeah.
GMO.
Do you get ablated for AFib or?
Have you had a? You
You
have?
did?
Twice.
Wow.
That's why I'm interested
Oh, yeah.
to know about this.
Yeah, so AFib is crazy because, like, I'm not sure how to explain it to you, but technically we don't know where it's coming from.
Yeah.
Honestly, like, we just done a bunch of like studies and have a bunch of data which support that if you isolate the pulmonary veins, like, chances are you're going to get it, or at least like reduce the burden a lot. But sometimes it could come from anywhere in the atrium.
Yeah, even the triggers. I sometimes don't know the triggers, but when I'm so tired, it can trigger.
Yes.
Really?
I even told them this is my first time, because since I have AFib in 2021, even after the ablation, I still can have AFib. Even worse, this second one, with the paraples, I still have AFib.
Oh, you had it.
But it stops sometimes. And when I go vacation or something, I always have AFib because of stress now.
Yes,
It's a
yeah.
different time zone and stuff like that. But for the first time, I just went to Spain and just came back. For 2 weeks there, I didn't experience AFib until I'm about to go home. And because I didn't sleep that whole night, because I tried to adjust the time zone.
Yeah.
Like, hey, I'm gonna be going anyways. But it was my first time that I did not have AFib the whole time, because
Wow.
my watch can tell me if I'm irregular,
Yeah.
So, and I've been checking myself,
Yeah.
and sometimes the medication will work, sometimes it will not. It's kind of weird. It's
Yeah.
very weird.
That is weird.
But I have observed, I started my AFib after Moderna. For the
These are
record.
little arteries that
Yeah.
are stemming off of that.
Just right after my second dose of Moderna, AFib came out. And I have some patients saying the same thing.
Huh. There's a lot to AFib that like your soul. Like,
Yeah, you never know.
That's crazy.
In your experience, guys, did you have, like, since you have more cases in AFib nowadays compared to before the COVID?
Kind of always been the
Yeah.
same.
Is it the
I'd
same?
say. Yeah, I don't know. It's hard to say because like I think our patients have increased also because there's like a better pathway straight from like the ER and things like that, so they find more
Or maybe
patients. Or, like,
because we have the watches now
that
that
too.
we can track.
Yes, that increases it too. So it's hard to say if there's really more people with AFib than before, at least from our experience, because we've always just done a lot of AFib cases. But
I want to see their.
Aorta. So it'll be just under your mitral valve, and it'll be kind of like up how we found the pulmonary vein, and we're gonna cut up through that and find the aortic valve. And you'll also maybe be able to see your coronary arteries that way.
You have your pins here. See those little ridges? I mean, those little tunnels there.
I know. I think it's. Yeah.
That's one there. It's going into the. Yeah. See that?
Oh. Go ahead. Thread it. Oh, okay. So that's the
One.
thing.
We have another one right on top.
So let me see where it come out. It came out from here.
Yep, there's the other one right there.
Oh, right there and there. Oh, we didn't just see it much. Okay. So that one here, and the other one is this,
Yep.
right? So there.
There you go. Yep.
Oh, thank you.
Oh, you're welcome.
So those are. So this is where they will do the
The
ablation.
ablation will go around.
Go around
Exactly.
here.
Yes.
Not just like that, but you have to
Sometimes
go
they can
around.
do just go around just like that. Yeah. They'll make one big one on the right side, one big one on the left side, or they'll go in between them as well. Yes.
Okay, so what does she want us to do now? She wants us
Find
to.
the aorta. So, just like this.
This is my aorta. I am in my.
Yeah, you may be able to see from the top
It's
of
going to be right underneath the valve there, right there. I want you to do it. Yeah, that's it. You see it? My finger's right through it.
Yeah, it's really big.
Yeah, go ahead and try it.
So basically, this is your atrium here. Wait a minute. This is your appendage is right there.
Correct.
And where is my? I'm just trying to figure out. This is my atrium, right?
That's your valve right there.
It's your valve. So look at that. It looks like my appendage is bigger than my atrium.
Right? This
Why
is
is
a big
that?
appendage.
Oh, really? So the appendage looks like it's bigger
It looks
than.
like another chamber.
So this
actually.
is my
Appendage,
like
yeah.
appendage right there, and this is my atrium right there, and this is my valve, and this is my ventricle
Ventricle. Yep.
passing through there. So the ventricle is big right
Yep.
there, and now I'm going to the
Aorta. There
aorta.
you
So
go.
from
You just-
ventricle
you just
to
hit it.
here,
Yep. You're in the aorta right now. There you go.
I am in my aorta now. Oh wow,
Yep.
this is big. Wow. And then you will have all the holes right there.
Yeah,
It's
it
like
goes- it goes on.
tentacles. It's like tentacles right there, going distributing all the blood to
To
your
the
system.
arteries. Yes.
Wow, right there. Very interesting.
Catheter, we have some that just
So is the pig's heart closer to the human side? What else is closer? Like maybe the cow,
No,
monkeys,
cows are too big. I would probably say primates. Yeah.
primates. Wow. Look at this. The mitral?
Yes.
Right? Mitral valve?
Yep.
This is strong.
Oh yeah.
So we also go kind of there
See that?
whenever we're bleeding the left side.
And this one is it's like a
Papillary muscle.
papillary muscle.
Yes.
So when they put the mitral, let me see, I'm trying to
The
think.
valve, the mechanical valve.
Yeah, mechanical valve.
They put it over the original.
Just right there.
They put it right over it.
Okay. Now I'm trying to think about the mitral clip, because the mitral clip, they have to just because this one is ruined already. It's so hard to how they put the mitral clip. They just wow, it's interesting with all this. How do you call this one?
This is the papillary muscle.
You know, like the grooves and everything. You know,
Trabecular.
trabecular something. And the atrium is more smooth
Yes.
than
Yes.
the ventricles.
Yes, and it's very thin compared.
It's very thin.
See
Oh.
the
The muscle, yeah.
Yeah, you can see how thin it is. See that? You can see it.
My appendage is even thicker than my
Your atrium, right? Yeah, this one.
my atrium.
And then you can see the difference between the left ventricle, how thick the muscle is compared to the right ventricle.
You think this one is a cardiomyopathy already?
No. They have thicker ones over there, like twice the size.
Really? Which one? That one?
Over here, they're pretty thick, yeah.
Oh,
Mm-hmm.
wow. Yeah. Very thin.
And it tells you, like, you see that's the
That's telling her
the
that.
tendon and how strong that is, how much pressure it takes to pull this. That's a lot.
That's how God good
Yes.
He is.
It's
He already
amazing.
designed that.
It's
That
amazing.
can last for 100 years, supposedly, unless you do smoking, drinking.
Well,
Well, maybe some of those do help. It depends what you're smoking.
Just a little bit.
Yeah, what you're smoking.
What is it?
Smoking this stuff, you'll be fine.
Now I'm wondering, do you smoke?
Only the good stuff.
Okay, let's not talk about smoking here. Where does the nicotine go? Now, I want to understand well, we're not there yet. Oh, no, yeah, we're doing it already. The left coronary.
We're doing the aorta. Yeah, you're probably going to have to cut. Go ahead.
I was wondering, are these, so this is your, anterior and then
Descending,
like descending. Are these the arteries that feed your brain? They go up there, right? These the four? Yeah, it's these four, right? Or like these ones right here, right? These are the ones that.
Oh.
So that's what someone else asked. I'm like, I'm pretty sure that's what it is. But.
Yeah.
So 1, 2, 3, 4.
So yeah, this is over your aortic arch, and like those
Aortic
four
arch.
vessels will go up
Yeah.
and feed your brain while the rest of it goes down.
So that means this big, well,
Yeah.
it can
Cause
pass
a
through
stroke.
there.
Yeah.
Can
Cause a
cause
stroke.
stroke. Because I had this one for my left atrial appendage. Oh, the ventricle
Well,
is
it
one.
won't
Yeah,
go
that was
through.
in her.
It'll block whatever's here.
It'll just block there.
Yeah.
If not,
It'll just block
yeah.
these vessels here.
It will block.
It won't go through.
It will.
I guess I never thought if
It's
it's
bigger. Look how
Oh,
big
so
it
it has to be smaller than this
Yeah.
to
Well,
create
to go
to
through.
go
But
through.
it can cause that problem from here also.
Oh, that's
Right.
right.
That's why I think even like a little piece like this going through like your
anticoagulants
left
because you have a
coronary cusp
clot.
into there,
Didn't it
'cause
cause it to like
with the
break
pressure
into
from
smaller
the
pieces?
coming down through the
Yeah.
aortic like root
could be
and out
more
into your coronary
dangerous.
arteries, you get a little piece that big that goes into your left common.
When they
Easily
catch
like
it,
put you into like it could easily cause like massive heart failure if it's not taken
So
away.
you
Just that little
really
piece.
don't need to have a big one, just a small one. It's enough for you to.
Super tiny. Yeah, not even something like that big. It could be something as little as that going through.
Wow.
Because I mean, these are like this is your left anterior descending coronary artery.
Left
Like look at
anterior
that. That is
descending artery.
that feeds the entire like front, like your septal or like your ventricular septum and like the anterior part of your heart. So if like it gets blocked up here, all of this muscle here, if it's not you don't get stented in time, it could cause that to just be like dead tissue.
So now my question is, where is this? That one that feeds the LAD, that feeds the coronary. Where does it come from? From here, somewhere here.
Oh yeah, here. So it's actually right in the aortic root.
Aortic root.
Oh, we still need to cut up to it.
Okay,
Here.
let's
So cut here.
Up here.
You keep cutting. Keep going.
Oh, what is this white thing here?
So this is the cut right there. All right, let's take a look. So this is right into your aortic root, and so this is your aortic valve. So here,
Aortic valve,
so
okay.
it's a tricuspid.
This is where we do the
valve.
cover, huh?
Yes, yeah. So here's one leaflet, here's another one. And you see how this leaflet, it has nothing behind it. It's just a leaflet. Here's your, what's called your right coronary cusp, because behind it is the right coronary artery. And that's what goes up to the right. Yeah.
Oh, wow.
Yeah.
So this is left.
That's
What is this? Left?
That's your right coronary
Right
artery.
coronary
So that's where our
artery.
right coronary artery originates, just under that, what we call the right coronary cusp, because that's where the right coronary, the cusp of that comes under it. So your aortic root, here's like your base, and then here's your three leaflets here. Two of them have the coronary arteries coming off of it, feeding the rest of the heart. And so when the heart beats, it squeezes blood up, and then when it relaxes, the blood pressure like pushes back down on it, it closes the valve, and then the blood pushes from that pressure out the coronary arteries to feed your right and left.
To feed.
So your coronary arteries are actually fed in diastole, during diastole, because the heart rests, the pressure comes down, and it feeds the rest of the heart. So we should be able to find the right side as well. So here's
There's
the
two, supposedly, huh?
yeah, so I think we cut through it here. Oh, here's the right. So this is obviously connected to this side. Here's your right. Here's your left. So this is your left common coronary artery. So you'll see that connects there. So if we're like closed here, this will go down here, and it
Let me
also
see, a
quickly.
smaller one. Let me see a
Yeah, it's a
smaller
little
one.
bit smaller. It won't go very far into it, but yeah. So that's where it'll split between the left anterior and then the left circumflex.
Wow, look
Very
at that. I
quick.
can pass through.
Yeah, you can get very close.
I can pass through there. And this is where they put the stent?
Yes. So if you have a left anterior descending myocardial infarction, and that's where the clot is, that's where they'll go and they'll put a stent into.
So this is the Widowmaker here?
The Widowmaker, it'll be on the left side of it. So it
I think
quickly
you said this is the
splits.
left side.
So this is, you are on the left side, but the common splits into the anterior descending and the left circumflex. The left circumflex is the Widowmaker. So let's see if we can actually find it. It'll go off more this way. So I'm guessing it'll be, I don't see it. It might be a little bit deeper in, but it'll go off, it splits anterior descending and then the left. And then the Widowmaker. But I don't.
Oh, I have blood already.
So that's where it'll feed into the left anterior descending, but it should split left somewhere around here. I'm guessing it'll be like, no, it's hard
So
to
if
see.
you have this one, so okay, let me see. Tell me, this is just the outside thing.
Yes, so this is AP right now.
Okay.
And so we're looking at the left side here. So here's the left, and it should split here. Oh, here it is. So this is your left circumflex. This is the left Widowmaker. Because look, it points to the left side here, and it wraps around and feeds to the left side of the heart. This all gets taken out if you get a myocardial infarction in that spot, and it's not stented very much.
So this is the left,
Yeah, the left circumflex.
left circumflex, okay.
So, oh yeah, you can actually see it. Yeah, it's right there.
Where is it?
It looks like, no, I think you had it, right? Yeah, it's somewhere like right
Oh,
there.
yeah, right there.
Yeah, so,
Oh, I dissected it.
and you see
Okay.
all of these veins, or these arteries, excuse me, that come off of it. This whole left side is fed
Look at
primarily by the left
it, and then you
circumflex.
go, this is supposed to be connected there.
Yes.
Left circumflex. Okay.
Also called the Widowmaker because it feeds that whole left ventricle. And if it gets taken out, most of that left
Yeah,
ventricle gets
can you
taken
imagine
out.
this? If this is clogged, all of this will not have blood
Exactly.
circulation.
Because you can see it wrap around, and all of these little arteries coming off of it are fed by that left circumflex. So that whole left ventricle, which feeds the whole body with oxygenated blood, is pretty much fed by that left circumflex. It'd primarily be driven by it. So if you get a clot there, it's guaranteed to be like heart failure, that kind of thing.
MI.
MI.
Wow.
I'll get out of here.
Feel free to continue dissecting your heart. After that, we'll be wrapping up. And we really appreciate y'all for coming
So this is the.
And that is the full circuit. If any part of that circuit isn't connected, then we can. And then going on to application times, the longer you apply the power, and then contact force is super important because the physician needs to be in contact with the tissue in order to drive that deeper. So more contact force is related as well. And with that said, the physician is really looking for high power, longer time, and good contact. And if you don't have really see anything from so far away right now, but this is essentially what we're
Yes, it's still up.
Right. We're doing the ablation now. This is radio frequency.
Okay, you ready? All right. Yeah, you can see the temperature is 93. Power's around 10 watts, 7 watts. 94 degrees per second. It wants to pop. Do you feel like he's stuck on it a little bit?
Try to pull up just a little bit. Yep.
Yeah.
Step on step.
Yeah. Wow.
Why is it stuck?
Looks like we're having perforation now.
No, I haven't had any injuries. I think there's been a case or two where the like coagulum forms that where you take it out, you can see like it's a little crusty. Nope, timed out. We can try a new spot.
No, try
Try a new spot. That's stuck.
Alright. Are you ready, doctor?
Ready, doctor?
Yeah.
Set. Go.
I put
Do you have to be gentle on this one when you're in the real world?
Oh yeah.
Yeah. It's like, oh, I just broke the heart.
You felt it?
Yeah, I see that. Right there.
Nice. Oh, I can see little bubbles pop for you. Sorry, I kind of looked too long for a second. I got carried away.
Yeah.
But yeah, if it airs
Wow,
out.
look at that.
That's good.
It created.
Let someone else have a turn.
Wow.
Grab it.
It's actually, oh, it's warm. That actually,
Cooking it.
that feels,
Okay.
this feels.
Good job. Good job. Oh, okay, go ahead. All right.
Ready for me to come on?
Okay, doctor.
What's the patient's name? Birthday.
Did we do a timeout, huh?
Where's the doctor's name? Delivering energy now.
No, we don't have one that has like a
You can
There
see
is a
already
bubble.
on the outside. You can see the lesion forming.
Yeah, it's waiting a lesion already.
Yeah.
Are you done it?
Not yet. I haven't done it. I'm gonna do it the thinner tissue.
Does it feel how much pressure?
So in real life, it does. So that because you don't want to push too hard, you can poke through. So in real life, the doctors, there's a little sensor, and the doctor tells the doctors how much pressure they're applying.
Can you move your catheter a tad?
It got stuck. So if it got stuck, what does that mean? What does that mean if it got stuck?
So what's happening is it's starting to cook the tissue and it's just starting to stick to it. It doesn't happen in real life.
Okay. I was thinking it's already well done.
Ready in your new area.
Just do it rare, please. Not not medium rare. Not charbroil.
Yeah, so it's like when you're doing this, does the blood come?
Yeah, I can see that. See that?
That's a turn system
We have
on.
this is like some of the more older models. And basically,
It'll just be a second. I have to turn the system on and
this
off.
one only has an electrode.
But you can see, like, with your longest lesion, how deep that is. As compared to that short lesion.
It's flipping. Why are you flipping? Okay, right there. Just a minute. Wait a minute. Go this way so we can see you. So this is where the close to the pulmonary vein, somewhere there. It's flipping. Okay. I'm ready?
Yep. Just find your spot you want to blow.
Yeah, here.
Coming up.
You do get That's what I wish you know.
I just do it gentle because it's a very thin tissue where the pulmonary vein close by.
So good. So you're delivering 30 watts. Since you have less contact force, you're at about 75 degrees.
75 degrees.
Yes. 37. So 75 is high enough for myocardial death, and it could be a professional coagulum and shock.
I see some bubbles earlier. What's the bubble? Bubble.
So in a real case, we're not going to be bleeding with the threshold at 90 degrees. It's going to be more like 45, 50.
Let me see. Did it go through? Yeah, it went through.
Yeah.
Let's do it again. Another one.
Okay. Another one. It's going to time out in a second, but see if you can get a little bit of couple of seconds.
Okay. Let's do here.
Ready?
Yeah.
Wouldn't the bubbles just be releasing energy into the water? That's great.
Come on, pop. I didn't hear it pop.
No, not yet. I don't think you've had enough force.
Wow, we have to go a little bit lower. I mean,
really,
a little bit harder.
really heat up
Okay.
that tissue.
Kumuasa. I was afraid to perforate my heart. Bubbles coming from.
So the system tries its best so that we don't have escape. So we're just trying to.
Now I know why the doctors is paid very high. This is a lot of work to do.
You want to see what it looks like?
You got
You're
stuck.
stuck in there.
Let me see. I can pick up now.
Yep. Yeah, you can.
So on our generator, we're able to control certain parameters, like how much energy is being delivered, and if the more energy we deliver, the hotter the tissue gets, and it could cause steam pumps.
So Riley's going to bring the piece of tissue around so that we can see. So our first lesion was a little bit less and a little bit of a shorter time, so you'll be able to see the difference between our longer and then our shorter lesions. And then y'all will be able to come up here and maybe create some
Okay, what is which one?
So this is the first lesion we did, and we were on for very long because the system
This
cut us
one?
off. Yeah, and as you can see, since we weren't on for very long, the white tissue around is really small. And then this is the second lesion we did. We were on for a longer period of time, and so that showed a larger.
That's the
lesion
ablation,
size.
right?
Yes.
And so that already creates a scar right there?
Yep.
And this one is not a lot.
Yeah.
You
So
need
this
more.
you would need more here.
You do more.
Not a great.
So
not
is it
great
a 50 degree? What is it? What is the temperature?
The temperature you're aiming for is 50 to 55 degrees
50 to
Celsius.
55.
Yeah.
And if you burn a lot, then what's going to happen?
So if you burn a lot in one place, you can either get char or coagulum, where it's kind of like you're heating up the blood cells and they're starting to stick to your catheter. And then if you go too far, you can get what is called a steam pop. And so a cell is mostly made of water, so you're essentially just boiling the cell and it explodes. And so that can cause holes to be shot through the heart, which is not good. But
Hole to the heart.
yeah, it can cause holes when it explodes. But when you go up there, you can try to make one. You can feel it, and it's kind of cool to like feel it here. As long as you just
Is this the Farah pulse?
no, this is
Radio frequency? What is it?
this is radio frequency.
Radio frequency.
Yeah.
Okay. All right, thank
So
you.
it's heated ablation. Heated ablations.
Heated ablation. Okay. Thank you.
What is it like the ablation when people like do this like type of procedure, like what are they like? Are they just hoping to get rid of like the lesions, like the dead, like?
Yeah. So essentially, what we're trying to do is ooh, heard that one. So essentially, what you're trying to do is create a scar barrier. So for AFib, as they were explaining earlier, we try to isolate the veins. So we're going to scar that tissue all the way around the veins, so no signal can travel across from the veins into the atrium. So we're just trying to burn this tissue so it can't conduct any sort of signal.
But for people who have like me, I already have 2 ablations.
Okay.
So supposedly it creates already a scar like that,
Correct.
and then another scar to the same place.
Right. Sometimes in the scarred area, it doesn't get all the signals all the time, and so you can have a reoccurrence of AFib because some of the tissue will recover. So if you had like an ablation like this, that's probably going to recover and still conduct tissue through. So that's why sometimes people need to.
So, okay.
Pretty cool.
All right. Ready again? Coming on.
Yeah, he didn't really do the dissection last time.
And then push hard.
He did this one.
Yeah.
But this year he was
I remember last year, like the last time it happened.
Tabitha, move it back onto the.
It was spread.
Yeah.
Nope, you're good. Push hard.
Oh my gosh, Mom.
It just felt like you were on the side there. Push hard, right there. Is it gonna pop? Come on.
So it feels like it's gonna pop.
It's got a really quick flow.
Yeah.
It's gotta be well done. Not medium rare.
What?
There you go.
Nice.
Wow.
Did you feel it? She's like, oh yeah.
Looks like we have a necrotic tissue now. It becomes dark, right? See that?
Yeah, you could go back and cut and see how deep it got.
Okay, go give it back to Veronica.
Looks like the tissue becomes
Giving your
black.
heart back.
Oh, whatever way you want.
Okay, let's look how much I did the ablation, how much ablation for this heart right here. So if you will look at it, this is the one I did for ablation. And let's cut it. How much I did.
Yes.
Whoa, look at that. I cook. That's I would say through and through. No, I think I did too much here to here. Right? It's not even medium rare. It's well done. Right there, well done. I cook my heart. Yeah, I cook my heart. I did it. I want to take a picture.